Hey, everybody. Just gonna let folks start to come on in. It's just 6:01 right now, so I will make sure that everybody is getting at least a couple of minutes. I hope everyone is staying cool in the heat dome that is on top of the Midwest right now. It's been quite a time. I'm here in the city, and so it has been very warm here. I assume that the suburbs are also quite warm. So please be safe out there. You and your young ones and your pets, please be mindful of your pets. They need a lot more water, at this time. So I will give it just a couple of minutes. And certainly what I am going to do today is just address some of the questions that were provided in advance. So I will be starting there, and then I think that I am going to do my best to enable the chat so that once I'm done going through some of those initial questions, we'll be able to perhaps get some more questions in today. So let me just figure out how to do that. And because, of course, this is, happening at home, do not, worry if you see a dog run right behind me looking kind of crazy. That's just what he does. He's kind of panting over there, and I can see that he may be getting a little bit upset about something on the street. So if that happens, you may see him jump up and twirl around. He may bark a little bit. It tends to be amusing for my patients when I'm seeing patients from home. They tend to like that. So let's see if I get these. Let's see. Okay, well, I am going to see if I'm not sure that I am, unfortunately, I'm not sure I am able to enable the chat. The setting may not be quite right, but I do see that there is do you all have if you all have a Q&A box, I see that there is, a Q&A box on my view, and I'm wondering if we can use that for any, questions. So if anybody, while we're giving it just one more minute for people to gather, if anybody, is maybe able to just test out, if you see Q&A at the bottom of your screen, if you're able to even just type in a quick hello to see if that is working. And it looks like it is. So that's perfect. So I will, so that's what we're going to do for getting our questions. And hey, Kristen, nice to see you virtually here. Always nice to, I appreciate that. So we'll be able to use this for our questions. That makes me happy. Okay. So one more minute. I believe in giving people 5 minutes of grace. So that if they were a little late, got a little behind today. And of course, those of some of you, I don't think that I see most of you in clinic, but you'll notice I am wearing blocker glasses. This is an evening habit of mine. I try to reduce my blue light exposure late in the day. And so if you don't have blocker glasses, I highly recommend you consider getting them. All right, and I see that we have a hand up. So let's see. I think that Nellie, it looks like you have your hand up. Is there something you wanted to maybe type into the Q&A? Unfortunately the chat seems disabled, but the Q&A does work. So and there goes the dog. So he'll probably calm down shortly as soon as that one dog passes me. Yeah, so anybody have any questions that come up as I'm talking, feel free to just type that into the Q&A. That seems to be a good place right now to receive questions. Right. All right. So I'm just going to probably have us get going here. Okay. So the first, and I'm just going to keep all of the people who submitted questions. I'm not going to mention any names, but if you happen to be on the webinar, of course, happy to see you. So I'm just going to start actually with a first question that came up about ketamine therapy. And the question was specifically, please explain when ketamine therapy is recommended for grief and how it helps. And I think that this is, an important question because ketamine is a hot topic. It's a complex topic. It's something that I actually do have some training in, so I feel pretty comfortable discussing it. So I think that the best way to think about where ketamine might fit in for grief is we can talk a little bit just about what does our data say so far. So what does the data suggest ketamine is best used for? And all of our original data really was in major depression. So these are people who tended to have generally recurrent depression episodes that were not really improving or responsive to more typical antidepressant therapy. And so the trials that we had done for ketamine generally involved doing an IV ketamine infusion once or twice a week. And that would continue generally for at least 6 sessions. And while the people were getting this infusion, sometimes they were getting, what we call guidance, and sometimes it was just the infusion. What we did, sort of see, is that when people went through a series of ketamine treatments, they had significant improvement in their depression scores. And these are validated questionnaires that really, can sort of track in a more subtle way how really effective a particular intervention might be. And so I think about ketamine, really sort of fitting in for refractory depression or refractory grief. And of course, grief is a type of depression. I don't really think that there's a time, frankly, where you couldn't pursue ketamine. I think maybe the question might be, is there a downside, to, ketamine, versus, other types of, therapies. And so I will admit I have maybe a little bit of bias around this just because I happen to really like ketamine therapy. I think that it's pretty remarkable because what it does is it really allows different networks in the brain to link up in a very new and novel way. The person who really mentored me in ketamine sort of described it as it's kind of like if you are an avid skier and you always ski down the slope the same exact way, the same exact slope, eventually you're going to have a lot of just grooves in that slope. Right? The skis have to go a certain way, and you're going to have a real difficult time going in a different direction or trying to change your route if you've been doing it that way for a long time. And the brain is very much like this. We have what's called the default mode network. And this is the part of our brain architecture. It's really a network that is kind of like that little voice that we all have that tends to kind of be a little bit on the pessimist side. So when you kind of have thoughts that feel, let's just say, a little self-defeating, and very pessimistic, it's usually coming from that default mode network. And the default mode network exists really for survival. We evolved as creatures who are more focused on the negatives in our environment, the negatives in our lives, because that's how we survived, right? It was important for us to be able to spot a threat. And in the more modern age, this default mode network can sometimes get in the way of us making progress, especially if we, are perhaps going through a big life event. I mean, grief, of course, can happen for many different reasons. I'm not sure, why this person is having grief currently. But any grief, in my mind, can kind of play into how our default mode network is wired. And we can find ourselves essentially caught in a loop, with our thoughts. And so getting back to that skiing analogy, what ketamine does is it's kind of like throwing fresh powder fresh snow onto that slope. So that now there's potential for that movement down the slope to happen in a different way. And so I see ketamine as really not just an anti-depression or anti-anxiety agent. I see it as an agent that potentially helps change the way people are actually thinking, at the level of like neurons. So I would say if you're someone who has been struggling with anxiety or depression for a very long time, maybe you've tried different kinds of treatments over the years and you're just feeling that maybe you haven't progressed as much as you would like. You want to know if it's possible for things to get better than they are. I think ketamine is worth thinking about. And I will say that I think ketamine does work best in a situation where it is guided. So I don't think that it's as beneficial when people are just receiving an infusion in a room and then they just get unhooked from the infusion and they go home. I think it's better for them to be engaging with people before and after their session. And I think that having some ongoing engagement, whether, generally in the form of a therapist, for what we call integration. So, you're taking those experiences under ketamine's influence, you're taking, maybe some of the realizations or, some of the things that you're grappling with. You can often come back to thinking and talking about them in a different way when you've been working with ketamine for a while. So I think that if you're struggling, with grief, long, it's been, perhaps a while, and grief really has no expiration date. Our culture likes to, get everybody back to work, so to speak, in 6 months or less. And that's not really the way grief is. It has its own timeline. Um, I do think, that it's worth considering ketamine if you're feeling like the grief process is really stuck, if you're not perhaps able to move emotion as much as you would like, or you find yourself really sort of stuck in ruminating thoughts. I think ketamine is definitely worth talking about. And again, as I said, this is, doing real life at home. Dogs don't always behave. So I apologize if he's a little distracting, but I hope he's a little bit amusing for everybody. So the person Kristen had put into the Q&A, is the nasal spray the same as the ketamine infusion? So it's a good question. So the FDA approved formulation, which is called Spravato, does have definite impact. I mean, it was certainly studied in various clinical trials. I think that the IV actually has more robust data. So people will, of course, choose maybe to look for the nasal spray because IV infusion, especially where you've got some guidance, can be harder to find. So Spravato is kind of like more of like a stopgap measure. So you do have to get Spravato from a psychiatrist generally who is specifically licensed to give Spravato. So it's not something that just any doctor can give. You have to be specially credentialed to do it. And when you get the Spravato, you have to go to the office to do it. It's not something you can take at home. So there's definitely a lot of rules and regulations around it. And I think that it has definitely helped some people, though I think that in my mind, the data for the IV is more robust. I think that's how I would see that. So I hope that that's helpful. Just that question about ketamine and the appropriateness for grief. So I'm going to now move on to our next question. Again, I'm just going to read it for everybody. I'm 55, but had a hysterectomy at age 40. I've never had hormone replacement therapy, but I'm interested in possibly starting a low dose estrogen patch because I still have severe hot flashes 15 years later. I've heard varying viewpoints on starting estrogen at my age. Do you mind sharing your opinion on this? Thanks in advance. Well, you're welcome in advance. So I have a very strong opinion on this. You absolutely should be on hormone therapy, full stop. And I'll qualify that answer a little bit. Unless you have a very compelling reason not to be. And there's not a lot of compelling reasons to not be on hormone therapy. For the record, those compelling reasons would include a current breast cancer diagnosis, a current diagnosis of endometrial or uterine cancer, severe liver failure, and severe heart failure. Those would be really some of like the main things that might, give you pause. I'd say the only other maybe relative contraindication that I would think about is if the person has a known problem with blood clotting, perhaps like a genetic disorder. You may want to think a little bit more about, how we use estrogen in that situation, because for some people, estrogen can provoke blood clotting, although very much that's more confined to when you give it orally versus when you're doing it in a patch. So coming back to this bigger question of why hormone therapy should really be considered for you, we as women need estrogen for brain health. We need it for heart health. We need it for bone health. We maintain our bone density better when we have estrogen support. We maintain brain connections better when we have estrogen support. So there's a reason why when you look at diagnoses of Alzheimer's, women outnumber men by like, I think it's like 4 to 1 for diagnosis of Alzheimer's. And in large part, we think that is because we lose estrogen. And then so many people have not had appropriate counseling about, starting this support. So I think that the main, things to understand, about estrogen, because this comes up all the time, is that there was one study in the very early 2000s called the Women's Health Initiative that unfortunately really caused a lot of fear about estrogen, concerns that estrogen support was going to lead to breast cancer. Fortunately, this became dogma in the medical. Uh, Sorry about that, everybody. Things just seem a little bit loud over there. I'm going to see if they can stop that. Again, dogs being at home. Real life is real life. So getting back to the Women's Health Initiative study. So essentially, when they did this study, they found initially an association between having estrogen, support and then developing breast cancer. And unfortunately, that became dogma for a long time in the medical community, and nobody was talking about estrogen anymore with their patients. And we went back and looked at all that data very carefully, did follow-up studies, and it became very clear that it was not actually the estrogen in that study that was leading to increased breast cancer. It was actually the synthetic progesterone, something called a progestin, that was actually leading to the problem. And we've since redone this study in different ways. We have not found associations between estrogen support and developing breast cancer. In other words, we have two groups of women, some on estrogen support, some not, and the incidence of breast cancer in both groups is the same. So it's not to say that the women on who aren't on hormones don't get cancer. It's not to say that the women who are, on the hormones, do or don't get cancer. The women get cancer at equal rates. So this, basically leads us to conclude that being on estrogen support in and of itself does not lead to developing cancer. And so when I hear, a 55-year-old person, you're writing saying, should you be, started on estrogen at your age? I think the answer is absolutely yes. I know that you have been, essentially in surgical menopause since you were 40, so you are 15 years into menopause. And there are some people who would say, well, if you're not on hormone support in the first 5 years, you shouldn't start it. That to me does not seem like a very evidence-based conclusion. I've really looked at this, I've really thought about this, and I don't see in my mind that there is a very good reason not to do it. I think that pretty globally, women do better when they are on hormones. They sleep better. They have certainly fewer hot flashes and symptoms like you're describing. Beyond that, I just think we age better with hormones. I think that's very clear. And I think that at 55, it is absolutely not too late for you. So this is a conversation I urge you to have, whether you are seeing a practitioner at peak or not. I really urge you, to have that discussion, with your practitioner. And I would not be dissuaded from some of the noise out there about about, oh, it's too late for estrogen. I do not think so. I have started women on estrogen in their late 60s, early 70s, especially women who came to see me for cognitive health concerns, and they all did much better on the estrogen. I think my record is I think I started somebody on hormones, low dose estrogen in her very, very late 80s. And this is a woman whose daughter is a physician's assistant. We had a lot of discussion about this. I, was not, feeling that we absolutely had to do this for an 88-year-old woman. But we had a lot of discussion about it, and I understood what the reasoning was. This person had had a stroke. There had been some brain health concerns. I started her on an extremely low dose of estrogen, and it was amazing. Just her memory and her interaction improved so much. So please, make sure that you speak to whoever your practitioner is about estrogen. And of course, we never give it without progesterone. They have to go together, even though you don't have a uterus. I think that you do need both because you have breast tissue, and breast tissue, of course, has receptors for estrogen and progesterone. Both of these hormones are meant to be together. They're meant to balance one another. Estrogen is the kind of go, go, go hormone, and progesterone is more of the calm. So they're meant to be with each other and balance each other. I don't agree with putting women on estrogen therapy alone unless for some reason they can't tolerate progesterone, which is really unusual. And then, of course, testosterone is a whole other discussion. So and we are very routinely recommending that women are on testosterone support now. So many things that you should be talking to your practitioner about. And if they're not doing a good job with your hormones, definitely come over to Peak. We have an excellent nurse practitioner who's really an expert in hormones. All right, so we have one more question that was submitted in advance, and then I'll turn my attention just to the Q&A for additional questions. All right, so this question says, can you highlight the bridge between lab findings, disease, diagnosis, and the nervous system as it relates to concussions? And I think the question is where the breakdown starts to be seen, either with the disease end of things or the nervous system side of things, and then starting a downward cascade to illness, and what is in place, or where do you see, healing start to ramp up? Okay, so this is definitely a sort of more complex topic. I'm going to try to, distill it out. So I think that I would probably really address this, through the lens of cell danger response. So some of you, who are listening to this webinar may be familiar with cell danger response, but for those who are not, I'm just going to give a very brief overview. When we say cell danger response, what we're talking about is the fact that whenever any of our cells are under threat, and that threat can be an infection, that threat can be some kind of a toxin, it can be strong emotional distress, so life issues, it can be a poor diet, so inflammatory foods, things like that. Anytime a cell is under stress and that stress is exceeding the ability of that cell to maintain its normal function, the cell will go into what we call a danger response cascade. So what that means is that the cell decides, well, we don't really think it's safe for us to just be carrying on with business as usual. We need to enter a sort of defensive survival posture, and we're going to stay in that survival posture until the storm passes. And so the cell will kind of move through a few different stages of danger response, and eventually is supposed to, end back up in a health cycle. And so the danger response is not a bad guy. This is just something that we evolved. It's present in humans. It's present in many other animal species. So it's basically a very sort of well-known cascade of cellular events. Where we can have problems is that for various reasons, a cell can get stuck at some phase of that danger response. And if that happens, now we're going to get symptoms. Now we're going to have chronic challenges like Lyme disease that feels like it never goes away, or mold toxins that we just can't get rid of, as sort of some common examples that might come up at a practice like peak. So when we sort of think about this question specifically about, the nervous system and concussion and how that feeds in. So a concussion would absolutely be a threatening event. That's a threatening event to the entire brain. So what that means is that with a concussion, you are going to have some number of cells in the brain shift into a danger response. And if the conditions of the entire system are not such that those cells feel comfortable moving back into a health cycle, they will remain stuck. And now there can be ongoing symptoms. So if it's concussion, some common symptoms could be things like headache, brain fog, trouble focusing, many other possible symptoms, but those might be some of the common ones. So when we think about, okay, well, how much of what's going on is a nervous system problem and how much of what's going on is a cell danger response problem? Well, the nervous system feeds in to the danger response, right? So when we think about, is the nervous system something that we need to work on when we're trying to, heal from a concussion or some kind of complex illness? The answer is absolutely yes. We can't heal if the body's system does not feel safe. It has to be safety. And so I think that this gets forgotten. Sometimes we're all a little guilty of this. We make a diagnosis of something and we want to go after the something. We want to treat the something because it feels like the most efficient road. And what I have found is that there are a large subset of people who do not respond to that approach. I do it that way and they may get worse. So I have to really think about, this piece. And so what do I mean when I say nervous system work? I'm really talking about practices that enable the parts of the brain that are most associated with survival and threat to just calm down a little bit. They just need to be a little less loud. And to do that, we have to basically give the nervous system and the body system in general inputs that there is safety. So this is where nervous system or limbic system programs, so things like brain harmony, primal trust, DNRS, Gupta program, these are programs that really help to kind of calm down what we call the limbic response in the brain. This is the one that's very associated with survival, very reactionary. There are various ways to improve vagus nerve activity. So the vagus nerve is, of course, one of the main ways that our parasympathetic nervous system actually works in the body. So, essentially, without good vagus nerve activity, it's harder to have a balanced nervous system. And common, symptoms might be problems with digestion. That's one of the most common ones. People have trouble having regular bowel movements, right? All of your gut is really, the activity of your gut is dictated by how well your vagus nerve works. So if people have a lot of nervous system imbalance, they're frequently going to have a lot of problems with their gut. Yeah. So I generally, thinking about, the bridge now, getting back to the question between lab findings, disease, and diagnosis, I think that our lab findings and our disease diagnoses are useful in terms of telling us where we may eventually have to put our efforts, right? If we know this person has active, Bartonella, for example, which is a common infection associated with Lyme disease, we may need to treat that directly. The question is, when are we going to do it? And what do we need to do in the meantime to build people back up, to get them to a place where they can actually do well? And so in my mind, you really need to work on that cell danger response piece before you start throwing a lot of, you know, powerful interventions at people, right? That may not always go so well. And I think the longer someone has been dealing with complex illness, the more important it becomes for that cell danger response to really be sort of the center of treatment. And so some of the common ways that we try to work on that. So I talked a little bit about nervous system training, certainly even home-based interventions, meditation, deep breathing, other types of, mindfulness practices are excellent. And then I also am a huge proponent, for those who know me, I am a huge proponent of really optimizing your light exposure. So getting outside for early morning sunlight, really doing what you can to decrease blue light. exposure. Yeah, as I said, I'm wearing these blocker glasses. Everyone should be really, or you should have some software on your computer that decreases the amount of blue light that you're being exposed to. This is a huge topic, and there are many good resources on this. And I think that I would take it from that perspective before trying to kind of go at it from the perspective of fixing the disease, so to speak, and addressing the diagnosis. I think that the nervous system absolutely contributes to the cascade of symptoms that this person is asking about, and I think that to stop that from happening, you have to work on the danger response part of this. So nervous system work, good quality light exposure, excellent water, good quality diet, all of this matters, so it's a really important for the foundation. All right, so we have a couple, of questions in the chat box. I'm actually going to address one that Claudia had written because it pertains to the question about hormone replacement therapy. And so she had asked, how long should women continue to take their hormone replacement? So again, there's definitely no one answer to this, Claudia. Most of the guidelines will say that if women are on hormones, oh, you should start talking to them at age 65 about discontinuing. I don't agree with that at all, as you can probably tell. I think that that's way too soon. I do think that once women have reached the point of, usually I'd say around, 75 to 80, I have a conversation with them. And what I tell them is that we don't really have extensive data looking at hormones in women over 75. And I think that's just, sort of a limitation of our research. We tend to not always be, frankly, very inclusive across ages. So I generally tell people that while we don't know necessarily from a research perspective what general outcomes are after, say age 75, many women feel worse when they go off their hormones. So if the person who I'm taking care of feels strongly that they would like to try to come off their hormones because they just don't want to do it anymore, they want one less thing to think about, I'll help them. I'll help them kind of come down slowly on their hormones, and then they can see how they feel. There are some women who come off hormones and they seem to feel fine. They don't, at that point really feel, they may not feel like they need it. The vast majority of women who come off their hormones don't feel as good as they did. They feel like their memory suffers. They sometimes develop worsening problems with joint pain, things of that nature, because your joints have a lot of estrogen receptors. So that's actually kind of a little known symptom of menopause is joint pain. And it's not just a quote aging problem. It's actually an estrogen deficiency problem. So my experience has been that most women don't want to come off their hormones because they feel pretty good. And so what they need, in my opinion, is just good monitoring. And what that means for me is I'll generally check blood work on patients at least usually a couple times a year, just to make sure that their estrogen and their progesterone are relatively balanced. That's what I use the labs for. Obviously, how the person feels is always going to be more important than the labs, but I like to see the labs just to see do they need more progesterone, or maybe even is their estrogen kind of low, and I may want to adjust what I'm doing with their hormones, because sometimes maybe they're not getting as much of a benefit if their levels are very subtherapeutic. I also recommend and heavily insist any patient of mine who is on hormone replacement therapy absolutely needs to be getting regular breast cancer screening. Now you may ask me, what are you talking about? You just told us that this isn't going to be more likely to cause breast cancer, and it's not. Where we have to be careful is that if the person on hormones happens to get breast cancer, it's likely not a result of the hormones, but we know that some cancers can be responsive to estrogen. So that's why when I talked about one of the contraindications for estrogen therapy, it would be if you have an active breast cancer, right? Because many breast cancers can grow in the presence of estrogen. And so my goal in recommending screening for everybody is that we pick up on anything that's concerning early enough and we make sure that we're not inadvertently feeding something that was going on in the background. The other thing I like to do for my monitoring is I will also check how women are metabolizing their estrogen. So I like to do some testing, something called the Dutch test. That will allow me to look more closely at how well people break down estrogen. There's more favorable pathways and less favorable pathways. And so when I just see how people are breaking things down, I can shift things a bit and make sure that I'm supporting their metabolism down that most beneficial pathway. Okay. So we've got a person here, who's talking about having a weight gain, puffy face, inflammation due to Hashimoto's thyroiditis. You've been working out for over 25 years, can't lose a pound. Took myself off of Synthroid for the last 6 months. TSH is 2.23. What to do? So for whoever this is right now, I feel you. I feel that you're, understandably very frustrated. And so I'll try to provide a little bit of insight here. So while Hashimoto's thyroiditis, of course, may be part of the reason why someone is not able to lose weight, there may be a lot of other reasons. And so the very short answer here is that I think you need more of an assessment for why you're inflamed. Why do you have this puffy face? The Hashimoto's thyroiditis, can, as I said, be a contributor to problems losing weight, mainly because those antibodies over time may interfere with how well the thyroid can make thyroid hormone. The fact that you were on some thyroid support and you weren't really noticing a change does make me question a little bit whether the thyroid is really the true root cause of all of this. Often the thyroid, I kind of think about it as like, it's like the canary in the coal mine. Any issue in the body, any imbalance, any problem can throw your thyroid off a little bit. And sometimes people, docs, we can look at these thyroid numbers and be like, maybe they could use some thyroid support. And we just sort of give the replacement without necessarily going down the thinking of, does that really make sense that this is the only thing? So I would definitely hope, whether you're seeing, someone at peak or you're seeing someone elsewhere, please talk to your practitioner about a more full workup for this. Because I would be thinking about your gut. Number one, there's a very, very strong connection between gut axis and thyroid health. I would be thinking about your toxin burden. So things like heavy metals, mold, these are all issues that can contribute to problems losing weight. And it kind of makes sense because all of those problems, number one, can cause your mitochondria to not work as well. If the mitochondria don't work very well, they're not going to do a very good job of burning fat and using that for fuel, right? So that's one piece of it. The other piece is that the body tends to like to put toxins inside fat tissue because then those toxins are not circulating in the system. So that can sometimes contribute to fat tissue, like those fat cells can grow bigger over time because the body is sort of using it as like a dumping area for all these toxins. So I think that it would be really great for you to have a deeper workup, but gut and toxins would be some of the first places that I would look at. And then within the realm of gut, you can start thinking about things like food sensitivities. Do you have like any really significant imbalance in your microbiome that needs to be addressed? So lots of issues here that may be in play. Definitely, please don't give up. please make sure that you get some attention, from somebody who can actually think through all of this with you. And of course, I don't know how old you are, and I don't need to know. But if you are perimenopausal, if you are in menopause, all of that is yet another factor. So hormones need to be balanced. Cortisol needs to be okay. Sleep needs to be okay. There's so many things that go into managing weight and losing weight. So if you're not getting the help you need, I encourage you, to really look beyond where you're currently being seen. All right. So we have another, person, who, wrote, what do you think is the best approach for someone living in mold who, for various reasons, is unable to get out of that environment? Yeah, so this is a really hard one. And I think that this comes up a lot. So my general best advice here is for people who aren't going to be able to leave their environment, and it's pretty clear that the mold is impacting their health in a significant way. I recommend doing what you can to optimize the space. So this means air purifiers, possibly in every room. I, generally recommend people have a lot of air purifiers in their house, whether they have mold or not. But mold is a very common problem, and air purifiers are not going to fix it alone, but they can help to just decrease your exposure. So I think that that would be my first piece of advice. And you want to make sure that you're looking at air filters that are going to be HEPA, HEPA. So you need HEPA air filters. You can also consider air filters that have an ionizing capacity, because ionizing, means that the mold toxins are more likely to fall to the ground instead of kind of floating, in the air with the spores and the toxins. You want stuff to fall down as much as it can. So instead of having it remain in the air so that people can breathe it in. So air purifiers would be number one. Number two would be really intentional detox support. And so to me, that means that you are hydrating with high quality water every day. High quality water, in my opinion, means that the water is pure. So I recommend all of my patients consume reverse osmosis water. I think that that is the best mix of just like purity and practicality. You can consume distilled water, but it's a little more challenging to have larger volumes of distilled water to drink. So I recommend people get a reverse osmosis system. You can install units under the kitchen sink. You can also have a countertop unit if that works better for you. But you want to make sure that your water is not introducing another toxic load. It doesn't make a lot of sense, right? If we've already got, one kind of toxin, you want to minimize other toxins as best you can. And we know that water has, when it's not filtered, it has a lot of stuff in it. And things like the Brita or the filters in the fridge, I just don't think they're good enough. I think that a reverse osmosis system is what everyone should be focused on. And then, making sure that that water is properly mineralized. Mineralized water is much more likely to get inside of the cells and do the work that it needs to do for you. So air filters, clean water to, just aid in general detox. The other thing that I think is really important for detox is to sweat. We don't often tell people enough about sweating, but sweating is really important. And that can take many forms. You can go outside and walk on a really warm day like today, as long as you're doing it safely. You can, of course, exercise and generate sweat that way. I'm a big fan of sauna. I think that sauna is a wonderful tool to promote ongoing detox. And because, many people, might struggle, of course, to get access to a sauna going somewhere. If you have a gym or something that you go to with a sauna, you can definitely access it there. I am happy that there's a company that I think has, in my opinion, kind of solved this problem. If they're called the Pod Company, POD as in pod. And if you look them up, you'll see that they have a device called a sauna pod. I have this myself, so I can speak, very in detail about it. It's essentially a pop-up dry heat sauna, and that's pretty amazing because it doesn't take up much room at all. It's like an enclosed cylinder, so it's maybe you've seen some of those saunas where you kind of sit in like a little pod and your head's like sticking out, but the rest of you is kind of like in the pod. So this is not that. It's actually a much better design, in my opinion. It's kind of like a tall cylinder, pops up with like a sort of metal frame, and you put the shell on it. There's a little like dry heater in the bottom part, and that thing, I mean, I turn it on for 10-15 minutes, and it's easily up to like 170 degrees. You don't have to go that hot if you don't want to, but it gets up to 170, 175 easily. And the main thing that you want out of your sauna is to sweat, and this one really does a great job. It comes with a chair that of course you can sit in. And, for saunas in the home, I think that the price point on this is about $700. It's not nothing. However, if you look at the price of most saunas, especially some of the infrared saunas, you're easily looking at $3,000 to $5,000. I find this to be an extremely practical sauna for people. Doesn't take up a lot of room, as I said. Easy to put up, not a big challenge there. So again, of course, sorry that my dog has just chosen this moment to be barking at the window. This is what happens. He's quiet all day, and then I come on this webinar and he's doing this. So I hope it's entertaining for everybody. Um, so I think that, with being in a moldy environment, you want to be doing what you can to help your body get rid of those mold toxins, and sweat is a great way in my mind to do it. So those are just some thoughts. And of course, even though I know you mentioned that, the person's unable to get out of the environment, I would definitely just not forget that sometimes just working on small pieces of the environment can be helpful. So if the person, for example, has a lot of mold in the bedroom area, well, working on that, even if they don't remediate any other place in their home, just working on a small piece could still make a big difference. It's kind of, if we sort of use the analogy of smoking, right? Like if you have a smoker who, they're smoking 20 cigarettes a day and then they go down to 10, you'd be really, really happy because they're cutting down. And it's the same way in my mind with the mold exposure. You want to do your best, even if you have to chip away at it, decreasing your exposure still matters. And so I tell people that because I think it is extremely overwhelming when the inspector comes and then you get the remediation, estimates, and I've been there. We've certainly dealt with that here, and so I understand how scary that can be. I also think that there is a piecemeal way to go about this that isn't necessarily going to completely ruin people's finances. And so I just offer that also, for people to think about. All right, so we have another question on what are my thoughts on BPC 157. I have many thoughts on BPC 157. I love it. I think it is a great peptide. Where I find BPC most helpful is really around joint health and soft tissue health. So that to me, is people who may have maybe a lot of joint pain, and maybe that comes from overuse over the years, maybe a history of Lyme disease, which is pretty common in my patient population. And so I find that BPC can be very helpful for a lot of those people. When you're trying to get the impact on joint healing or just healing in general. So I put people on BPC, some of my patients who've had, let's say they're going to go for a big dental surgery or they're going for some other procedure, a surgical one. I will generally get them on injectable BPC as soon as I can, as soon as that procedure is done, because it really helps with soft tissue healing. So I love it for that. I think injectable is probably better and more impactful, for those situations. And I would say that most of my patients who have seen big joint impact from BPC are doing injections. You can do BPC orally. I think that orally it is really great for the gut. That's where I think oral BPC really shines, is when you're trying to support a healthy gut barrier, and you're trying to sort of generally decrease inflammation. If there's a history of stomach ulcers or things like that, I think oral BPC is a great consideration. I think that, and as I'm saying that oral may not be as good as injectable, there are newer forms of oral peptides coming out that are liposomal. So companies like Quicksilver have been playing in this space now. And, you can essentially, the peptide comes in kind of a pump delivery bottle, liquid. And so you can basically put it under your tongue, hold it there for about 30 to 60 seconds, and then just swallow it. Most of the absorption has already happened under your tongue. So that's another way that you can, experiment with it. And if you're a person who's just, wondering if it would help you, you can certainly consider, trying out some products. Of course, if you want to go injectable, I will always recommend that you work with a practitioner who can actually get that from a compounding pharmacy. Research pharmacy or research companies are falling out of favor now as more peptides have come off the list of concern. There's really a resurgence in the field now of focusing on compounding them as opposed to going through research companies where it can be quite difficult to verify what you're getting. So that I hope that that's helpful. Definitely a peptide worth experimenting with if you're curious. And then we have a question from Mia. How does the gut microbiome change as you age, and what steps can be taken to improve it through food? How does a healthy gut microbiome influence disease outcomes? Oh, I really, really love this question. So I would say that as the microbiome ages, we tend to lose immune tolerance. So some of the bacteria strains, we call them kind of keystone species, the ones that really sort of dictate keeping the immune system well balanced, those populations can sometimes die off over time. And you start to get what we think of as a more inflammatory signature in the microbiome. And that can look like increased symptoms in the gut. That can be part of that. What it can also do, though, is create more leaky gut. What, it's formally, we call this intestinal permeability, but, colloquially, it's leaky gut. And when you have leaky gut, that is really an opening to a lot of other disease states. So this is where, what is happening in the gut then really starts to exert a whole bunch of systemic effects. So problems with the liver, as an example, problems with, joints, problems like rheumatoid arthritis, osteoarthritis, issues with the heart. There's a lot of things that are tied to leaky gut. We don't want leaky gut. So we definitely need to think about keeping the microbiome in a less inflammatory state as we're aging. And so when you're asking like what steps can be, taken to improve this through food, I think that you want to be eating as many whole foods as you can. And what I mean by whole foods is that it's just the food, it's the food, as it sort of exists in nature. Our culture, we prioritize, convenience. And we prioritize simplicity, and there's a time for that, absolutely. Unfortunately, that means that a lot of our food is sometimes very highly processed. It's not in the original form that exists in nature. And where that can be a problem is that the body doesn't necessarily read the information from processed foods the way it does from real food. So, having, a piece of, well chosen steak, for example, is much more helpful for me than having a bunch of dried beef protein powder. I may look at the label and it may give, maybe these things are giving me the exact same amount of calories, the exact same amount of protein grams, but the nutrition value goes beyond that. It's not just macros. And I think that we want to be thinking about eating more real food. We want to be thinking about eating food that is supporting the microbiome. So that is going to be your vegetables, your colorful vegetables, your colorful fruits, low glycemic. So things like blueberries, for example, raspberries, um, and fiber. We have a lot of people who are just not eating enough fiber and resistant starches. So these would be anything foods such as legumes, so beans, lentils, chickpeas, for example. These would be, certain vegetables like asparagus, carrots that are very rich in soluble fiber. And then these may be, even, some of our, resistant starches. So things like, cooked and cooled yams, cooked and cooled potatoes. There's many things here. But I think that if people were eating more real food and fewer processed food, that would be an excellent first step. And I do think that a healthy gut microbiome does really improve your outcomes with your health concerns. It's very clear to me that it has to, because a better, microbiome generally means we've got less intestinal permeability, less leaky gut. And that means that our systemic inflammation is going to be way less. So yes, absolutely worth, it's absolutely worth it to, work on the microbiome with your food. And then I think we've got, question, from Lisa. Hello, Lisa. And saying, hey, what have you seen work well for neck Lyme arthritis and pain at the base of the skull? I'm still BART and Lyme positive after 11 years. Okay, yeah. So this is challenging. So of course, when you say you're still, BART and Lyme positive, it's hard, That could mean that you've been exposed, but the pathogens are kind of quiet, or that could mean that the pathogens are still very active. So in terms of, the actual joint pain and then the neck, I would be thinking about a couple things. One is, do you have maybe ongoing pathogen burden that needs to be addressed? And there's many ways to think about that, right? That could be, things like herbs and supplements. It could be antimicrobials, antibiotics. It could be advanced precision things like ozone and things of the like, right? So one question is, if this is driven by uncontrolled pathogen activity, then I think part of the answer is having to kind of focus on that. That being said, sometimes people are gone through a lot of different treatments and some of their joint symptoms are just really stubborn. They just haven't really moved. So this is where it would be worth it, in my opinion, to consider a couple options. One for, pain at the base of the skull. I'm a very big fan of having people get some evaluation from an osteopath. That's a DO who's practicing osteopathy, or a cervical chiropractor. So what's called a NUCCA chiropractor, NUCCA. These are people who generally can really assess this area with both exam and imaging to understand, do you have any area of impingement? Is there something pressing where it shouldn't? And sometimes just with, good, manipulation technique, they can help to open up, some of those areas, which can really help to decrease the pain. Another thing you could consider would be actually looking at some of the regenerative therapies that are out there. So, and we do these, at Peak. So there's a whole variety of these. Rachel is our, expert. She's a nurse practitioner at the clinic who does all of our consultations for this, does all of our procedures. But really, I would be considering anything from prolozone, which is a combination of prolotherapy and ozone injection, especially if you've got a lot of point areas like pain, just like right there, or pain like right here. If there's like an area where the pain is like very concentrated and pointed, I would be thinking about something like prolozone. So that's really two injections. It's a you've got prolotherapy, which is essentially a bunch of elements to help decrease scar tissue, improve oxygen in that space. And there's a little bit of like sort of local anesthetic there. So there's like a temporary numbing effect of it. And then that's generally followed by an ozone injection, which helps to break down scar tissue, helps to improve the utilization of oxygen, which means that those cells are going to be able to function and heal a little bit better. So that would be something to think about. Platelet-rich plasma is another modality that I would definitely ask Rachel about. I also have seen, I have a patient of my own actually who has had really difficult neck pain for years and didn't know she was positive for Lyme-Bartonella. I actually just diagnosed that earlier this year. And so she did actually do some exosomes with Rachel. So exosomes are, you could think about them as mini stem cells, kind of the easiest way to explain them. They are able to essentially, you can think about them as like messengers that go between cells. So they contain a lot of healing information, a lot of healing influence. And they tend to really go where the damage is. So they're broadly speaking very reparative in many tissues in the body. Obviously, if there's a focal pain problem, you want to inject, directly like where that pain is. So there's a lot of potential, things that I would, be thinking about, there. So definitely, again, if you're in a lot of pain, I would be considering make sure that you've got a good, assessment from a DO, or a NUCCA chiropractor, because that's definitely worthwhile in my opinion. And definitely consider a consult with someone like Rachel. If you're not already a patient at our clinic, she is really excellent. She's got a great handle on all these different therapies, and she can really explain the differences to you. And then I have a final question in here saying, how soon long would it be to get an appointment with you? And so, yeah, you're very sweet, Kristen. So I think right now I'm probably booking about 2 months out or so. I think I'm certainly still taking new patients. And you can always call the clinic and just see when my next available is. But yeah, I'm pretty sure I'm booking sometime in August right now, or maybe September. I don't know. And then, so Nellie, I think you've got your hand up, and I don't know if you meant to have your hand up, but it would be, if you have any kind of a question, please type it in the Q&A, since we're actually just about at time for the office hours, and I don't want to leave any question unanswered for you, but if I would love to answer a question if you have one, you're welcome to put it into the Q&A box. But as we're starting to finish up, I'll see if Nellie was going to put in a question here. But I just wanted to, as we're finishing up, say thank you to everybody for spending a little bit of time with me, spending, this hour. It's always great to just sort of come together and just sort of spitball answers and think about all these different topics. And if it's something that you enjoyed, please, please, let people know on social. Come to the next one. We're going to try to be doing this more often. And as a, special, thank you. We are, offering for anybody who attended this webinar, we are offering 20% off a 5-pack of ozone treatments. And so ozone, is really a pretty marvelous therapy. If you've never experienced it, the main thing to know about it is that it's a fantastic way to help your cells improve the use of oxygen. And that's one of the main reasons that as we age, that our cells don't work very well. It's also one of the main reasons why we have a lot of symptoms. We talked about danger response and all of that stuff. A lot of that means that the cells aren't using oxygen very well, which means that all of the behavior of the cell kind of halts. So ozone can be a great way, whether you're someone who's looking for some optimization and some maintenance, or you're someone who's maybe actively struggling with a lot of symptoms. Ozone is a fantastic modality to consider. If you're interested in taking advantage of that offer, you can definitely call the clinic and just let them know that you attended this webinar, and they'll certainly get you situated. All right, everybody. I hope you have a fantastic rest of your night and excellent rest of your week. Please be well. Like I said, please, do not be in the heat too much. I hope the heat dome will be leaving us soon, but we're still with it for a few days. So please be safe out there. You take care, everybody.